Sorry, guys, what I was saying is, sorry, guys, if I sound sick, but it seems like I'm getting worse, not getting better. And I hope I get better soon. Okay. Please, guys, seems like I'm on Facebook right now. I'm on live Facebook. So please, guys, if you can hear me or you can see me on the Facebook, please, guys, let me know. Okay. Just make this one a little bit bigger. Guys, am I guys on Facebook Live right now? I know there's always a delay of couple of minutes between Zoom and Facebook. Okay. Okay, guys, today's session, it's a very important session for dental carers. And again, I always say dental carers is the most important topic for, oh, sorry, guys. It's the most important topic for ADC exam, either for part one or part two. Why this? Because all the subjects, all other papers, or other OSCE stations, they mostly related to dental care. So you're gonna get an issue started mostly because of dental caries. Whatever is the subject, it can be dental surgery, it can be endo, can be crown bridges. So the reason behind it, or the main reason, it can be dental caries. That's why understand about dental caries is really something important. We don't right now pediatric, and this is for part two for our OSCE champions. And then for part one, tomorrow as well will be pediatric as well. So I would say that could be a good topic for both of you right now. Okay. So guys, if you are happy or you willing to do role play today with me, I will be very happy. If any of you guys brave, I would say the word brave. And I'm sure guys, all of you really good in this, but I know some of you really may not really feel that comfy to do role plays. But guys, if you're really happy to do role play, please let me know. Okay. Yeah, I checked now on the Facebook and then I see, I believe, guys, you can hear me right now on the Facebook. I see Dr. Shweta. Hi, Dr. Shweta, how you going? Dr. Melzma, how you going? Yes, that is great then. Thank you, Dr. Kainet. How you going, Dr. Kainet? Dr. Shreya, thank you very much, Dr. Shreya. By the way, guys, these are the comments on the Facebook. Okay? Just in case if you ask from where did I get these comments, because actually on the Facebook. And please, admin of possible, you share the link of the Facebook on the Telegram, sorry, yeah, in Telegram groups and also in Zoom chat so everyone can join. Hi, Dr. Shreya, how you going? Yes, there's a delay in about not couple of minutes. Yeah, it could be the start couple of minutes, but after this, it ends to be only maybe 20 seconds or 30 seconds. Hi, Dr. Jilan, how you going? Dr. Mo, how you going? Dr. Ma Fauzi, Dr. Maria, Dr. Liv, how you going? Thanks very much. Dr. Suyash, how you going? Dr. Fiz, Dr. Tasneem, I'm doing great. Dr. Fatima, Dr. Mubaraka, Dr. Natalie. Yes, I agree in this, Dr. Lev. It's actually a great topic. Hi, Dr. Kagandeep. How are you going? Dr. Endra and Dr. Shishank. Okay, guys. So now, hi, Dr. Nilu Nilu. How are you going, Dr. Nilu? And Dr. Parsia. How are you going, Dr. Parsia? Thank you very much, you guys. Okay, now, hi, Dr. Mubashir. How are you going? I'm great, guys. Thanks very much for asking. So, guys, I'm just waiting now, maybe for a minute or a couple of minutes, guys. If any one of you is really happy to take this opportunity and do role plays, especially if you just start your OSCE right now, or if your exam is soon. So that's going to be a good test because I will give you a feedback. Thank you very much, Dr. Main. Thank you very much. You're really great, Dr. Main. Thank you very much for saying this. She's the only one wishing me speed recovery, guys, Dr. Mahin. Thank you, Dr. Ash, very much for saying this. Okay. Hi, Dr. Hash, how are you going? Dr. Koshikan, every one of you. Okay, guys. Now, let's start with the case itself. I may wait maybe because I got on the Telegram group. Some of you guys mentioned you really need to do replay. I'm just waiting maybe if you're going to do it. Dr. Mubashir, I believe you said you want to do replay and other people as well. So what do you think? Dr. Parsa, you want to do it too? That is great then. Wow, that's a good spirit, Dr. Lev. Okay, let's now, guys, go with Dr. because I'm not quite sure now should be Dr. Mubashir or Dr. Parsia because Dr. Mubashir has mentioned in Telegram and then Dr. Parsia mentioned here. So I may go with, I'm not quite sure. Who should I go with now? Dr. Amna? Dr. Bidu, I can do role play. Okay, so maybe this time will be Dr. Parsia because his first one has commented here, right? And then next time will be the rest of you guys, okay? Anyway, we gather the sessions every Tuesday because we used to this in the last 6 years. So we are back again because we start the new course. So back again in this classes. So guys, you're gonna get the help, okay? Vote not today. Okay. Dr. Parase, are you in Zoom? Let me check if you are in Zoom so I can let you talk to me. So we both can talk together. Dr. Parsia. Yes, okay, that's a great then. Okay, we may have echo right now, so let's check. Can you please speak now, Dr. Parsia? I will make you co-host, so you can be always on unmuted. You now can unmute yourself, Dr. Parsia, if you want. Dr. Parsia, can you hear me? Unmute. Okay. So if not, Dr. Parsia, because I'm not quite sure. Sorry, it just logged out. Okay, that's fine then. Take your time. No problem at all. Otherwise, I may try also now with Dr. Mubashir, at least to check my
Hi, Dr. Bido. Hi, everyone. Can you hear me?
Dr. Mubashir. If you are in Zoom, that would be great. Or Dr. Amna. Please, guys, you need to
Hello,
be in
doctor.
Zoom. You need to come back again to Zoom. Both, please, Dr. Amna, Dr. Mubashir, because I see you not in Zoom.
Dr. Adam.
So you need to be
Dr.
on
Adam.
both Zoom and Facebook then.
Dr. Parsi, am I audible?
Yes, doctor, I can hear your voice. Can you hear mine?
Yeah, let me
Yeah,
check
Dr.
with
Parsi.
Dr.
Okay, I think you say something now.
Dr. Parsi, am I audible?
Yes, doctor, I can hear your
Okay.
voice. Can you hear mine?
Yeah, let me
Yeah,
check
Dr.
with
Parsi. Okay, I think you say something now.
Dr. Parsi, am I audible?
Yes, doctor, I can hear your voice. Can you hear mine?
Yeah, let me
Yeah,
check
Dr. Parsi. Okay, I think you say something now.
Dr. Parsi, am I audible?
Yes, doctor, I can.
Okay, doctor, can you hear me right now?
Yes, doctor, I can hear you.
Is there any echo, do you think, right now?
No, there's no echo at the moment.
Okay, that is great then. I'm very happy. Let me just put this one totally down. Now I think there will not be any echo at all. Okay, are you ready for the replay?
The quality of your voice reduces great time, but still you're audible to me.
Okay, what do you think now?
Oh, that's great now.
Okay, that's very, very good then. Okay, all the best to you then. I will share the screen to you and then
Thank you.
no problem. All the best. The case a little bit tricky because
Okay.
I actually when I do cases, I don't rely on any one sort of information. I always keep changing the information because an exam will be the same. And this is my advice to everyone, especially the new candidate or the candidate couldn't pass OSCE for multiple times. This most probably because you follow some notes only, and then you don't have the proper communication skills based on the clinical findings and the information provided here. So now, Dr. Parsia, you can see the screen, right? You can see the case.
I can see the case. Yes.
Okay, let me both of us. Let's go through the case together, just in case if you have any doubts about any of these points, I will be very happy to clarify it for you. Okay.
Sure. Let's do it.
Okay, so let's start with the first point. So it's a brown color set. You know what's a brown color set, right?
I know. Yes.
Very good. So now, an 8-year-old girl, her name is Sofia, was actually probed by her father, Malcolm, after traveling 300 kilometers, which is about 4 hours for the treatment. And then Malcolm reported brown spots and visible cavities on her teeth, along with generalized pain. So the pain right now generalized. It's not only in one area. It seems like all around. And sensitivity, especially when food was trapped or during biting, which improved after brushing. The pain had worsened over the past 2 nights, causing sleep disturbance. Means she couldn't sleep for the last 2 nights. Sophia was uncooperative during examination, but biting radiographs were successfully obtained. Now, this is your job. You understand that your job is your job. Your job must be covered, right? So I don't care about anything in this scenario except you cover the 3 points. Clear right now?
Yes, doctor.
Yes, I know I
Clear.
understand this very well. communicate the findings to her father, address the father's concern and clarify any questions, develop and explain a tailored treatment plan for managing the child's dental condition. Now, you're gonna get 3 months reading. So in 3 months reading, I need you to cover the 3 points nicely, make keywords for yourself, organize your ideas based on the findings and based on the whole scenario right now. Okay?
Okay.
That's fine. Do you have any question for me? I will be very happy to discuss any question you want about this case.
Well, can I ask exactly about the case or in about
Definitely,
general?
anything.
Yeah,
I'm very
so
happy with anything.
this is the first time I see this case like this, but I shouldn't be surprised because changes happen, and I know that things can go sideways in exam. But now I see this pain. I see this case. Patient has got sleepless night, which indicates irreversible pulpitis. That should be one of my diagnoses. And generalized pain. So pain is coming from multiple teeth. Am I right? Do I get it correctly?
You're very good. Yes.
So these and also I need to know well, it says communicate findings, address concerns, and explain and tailor treatment plan. So it's cluster 3.
I agree on that too. Very
So when patient has got generalized pain sensitivity, we need to find out which tooth is causing the most pain because it's uncooperative patient and also is coming from far distance. So we need to definitely get patient out of pain as much as we can.
true.
So we have 2 teeth, actually three teeth that can be possibly irreversible pulpitis. One of them is 8.5, as I can see in the X-ray. The other one is 7.5, and also I think 5.4 was having a very deep decay. But the tooth with necrosis, most likely 7.4 will have necrosis. I don't know which one can it be. I should ask some question from the patient that can, do you know if patient can tell which pain is causing the worst? This one is the one that causes food impaction and pain and biting, which goes away by brushing. I know that. The lower left-hand side.
Okay. Yes. Can you hear me?
Yes, I can hear you. Yeah, I'm waiting for the answer. Yes.
Yeah, so the answer right now is, based on the X-ray, you need to explain to me which tooth it can be the cause of today. That which one do you think is the cause of the pain that's the patient causing? Because this is our priority. We're looking for the tooth that's making the patient cannot sleep, right, for the last 2 nights, and we need to fix this teeth or this tooth. It can be 1 or 2. Not necessarily to be only 1. It can be more than that, right?
Yeah.
And then you need to know which teeth that the food, when it's impacted inside or lodged inside, he may have some pain, and then the pain will relieve once you remove the food. And I will not leave you alone. I will not leave you in peace. I will ask you more questions about the rest of the teeth as well.
Okay, yeah, let's give it a try. I mean,
okay, I tell you something, okay?
because lots of people are listening, I don't want to give wrong information.
No, it will
That's
not be
one of the
because anyway.
worries. Yeah.
No, will not be any wrong information because anyway, I will
You
be
will cover
covering
it.
this case just with you at the end, right?
Yeah. All right. Okay.
Yes.
That was my
There is
biggest
no wrong
question. I think
information as wrong information here, right? Because I'm just giving an example, but I will
Yeah.
not give you the trick behind this case, okay?
Sure.
Okay, for example, right now, if you ask me which tooth of these, it can be which side at least, which side, that it can make the patient couldn't sleep last night, I will tell you the left-hand side. Why? Because you see now the caries is too deep
Yeah,
into,
too deep.
yeah,
Yes.
too deep. And which side that the patient, when they eat, the food gets stuck in the holes, and then once they try to fix it or try to remove the food from the holes feels better, I would say the right-hand side. Because you see there's a
Okay.
little bit of dentin ledge here, and then the
Yes.
cavity not as deep as this one. The second thing here right now, the second two most important things. What are you going to do today? Are you able to do anything today? And how will you do this?
I will do my best to get out of pain, patient get out of pain. Yes, I will try to use all the tools I have to make patient comfortable. I will use tilt do distraction, highly trained nurse. I've done the course for nitrous oxide. I'm happy to use it, the happy gas.
Perfect. Perfect.
That should make her
Perfect. That's what I
comfortable.
want to hear. Perfect. How you call this strategy?
Um,
Or the strategy, how we call it?
the strategy, behavior management.
behavior management. Very good then. Most of you have mentioned right now, it comes under the behavior management strategies, right? But one of these, it doesn't come under behavior management. Which one was it mentioned right now? Doesn't cover natural
Nitrous
side.
oxide.
Okay, very good. Okay, I'm very happy with this information you provided and this strategy you follow right now.
Let's see if you're happy with my role play as well.
Yeah, oh, definitely I'll be happy. I can tell from the beginning that you are on the right track. Your
I'm a
question
bit
at the beginning actually being very nice questions.
I'm a bit out of practice, as you know. So it's been 1 month that I didn't do any study, but now I'm back on it with full power.
I'm sure you're gonna do the best right now. I know you're smart and definitely like you already passed all this before, so you know it very well. Okay.
All right, I'm happy to take my 3 minutes, please.
Okay, let me just get here in this point, please. Show meetings. Think I need to go to more. And then I need to go to apps. Post. Okay, guys, I'm saying 3 minutes for Dr. Party right now. So more go trans to import apps. Yep. And then that's a timer. Okay, now I will change to 3 minutes. Okay, we'll be able to see the timer right now on Zoom at least.
Yes, I can see. Yes.
Okay, all the best to you then. 'Please, admin, there are champions actually in the waiting room. 2 minutes left. Okay, 1 minute and 20 seconds left.
Thank you.
No problem. Thirty seconds left. Okay, stop, please.
Mr. Malcolm, I'm really glad to see you guys today. I'm sorry that Sophia is in pain, and I appreciate that you traveled this long distance to come and see me. I believe, as I can see in my notes, that Sophia has experienced 2 sleepless nights because of pain. Would you be able to explain more about it and tell me about it in your own words, please?
Doctor, as you mentioned right now, you're totally right about it. Svea is a beautiful girl, and she's really in pain for the last 2 nights. I really feel very so for her. She's in really very bad pain. She couldn't sleep, and then sometimes when she eats, she complained that there are lots of food stuck to her holes. And then once I tried to brush the teeth and then get this food out from her holes and teeth holes, and then she started to feel better. Doctor, I'm not quite sure really. I'm very stressed and distressed for her, and then I really need to do something.
I'm so sorry that you're stressed. I totally understand. Of course, Sophia is a beautiful girl, and seeing her in pain is something that makes my heart drink. But definitely, we will do something today to get her out of pain as much possible, and then we will come up with a long-term plan to prevent these kind of things from happening. I managed to take 2 small X-rays from each side of her mouth, which we call them bite wing X-rays. And these in bite wing X-rays, I can see multiple decay happen in her teeth, which is cause of both food catching between her teeth and also the sleepless night. I will explain what I can see in these X-rays. I will start from the top X-ray, which shows the right hand side of her mouth, what the tooth on the top, if we count from the back, the third one, the one that exactly my red point is on it. This tooth has got a very big decay, but it hasn't got exactly to the nerve. This tooth can cause pain that goes away as soon as the food is not touching it. The tooth at the bottom of it, if we count from the back, the second one, I can see big decay happened in it, and it looks like that breakage has happened in the outer surface of the tooth. Are you following me so far?
Yes, doctor. So what does it mean?
Yeah.
What does it mean the breakage has
Exactly.
happened on
Yeah.
the yeah.
So the breakage means that there is a spot that food can get caught in it and stays there for longer time. And the same as you said, with brushing, the food comes out. And because until you brush it, food is there, it can cause sensitivity to the tooth. We call this reversible pulpitis. It means that with simple feeling and removal of the decay, tooth will get back to the normal and sensitivity will go away. Does that make sense to you?
Yeah, doctor, how much you confident about this? Are you 100% sure that could be, as you said, reversible parties? And could you please explain a little bit more? What does it mean exactly?
Well, yeah. So About being 100% sure that it's a reversible pulpitis, I need to do some more investigations, but with the symptoms that you provided to me, most likely it can be reversible pulpitis. What does it mean? The decay forms when we eat food, sugar and bacteria together, sugar from the food and bacteria in the mouth together over the time can cause production of acid, and acid will dissolve the tooth. Okay, dissolve the structure of the tooth, and that is now what we call it decay. When decay is not attended at the first at the beginning of it, the breakage will happen because the tooth is softer, and through the bite forces it can break. And what we can see here is exactly like that. But about if it's irreversible or it can be more than that, I need to remove the decay from the tooth, and if the underlying surface, which is the nerve and blood supply of the tooth, is intact, I will be 100% sure about it. Does that answer your question?
Yeah, doctor, that is okay then, doctor. So, doctor, why she couldn't sleep last night then?
Well, can you tell me if you know which side exactly the pain came from? Did she report that to you?
I believe she said like, I'm not quite sure, but last night she put
Did
her
she
hands.
point?
Yeah, look, she put her hand on the left hand side of
Left hand
her
side.
face. So I'm not quite
Yes.
sure.
That's what I guess. So now I'll get your attention to the X-ray at the bottom, which shows the left-hand side of her face. The bottom teeth, if we start counting from the right-hand side and move to the left, the second one has got a very big black area, the shadow, that is decay,
So,
which
doctor,
has gone.
sorry, doctor, I
Yes,
got confused right now. Is that
sure, go
from
ahead.
the top or the bottom teeth? Sorry.
Bottom teeth, bottom
Ah,
X-ray, bottom teeth, second tooth. That the third tooth has got a very big shadow, but it has gone all the way to the pulp of the tooth or the nerve supply. This area that I'm showing to you, and that means that nerve of the tooth is already dead and the tooth is broken. But the tooth behind it, we start counting from the right hand side, the one that I'm showing to you. Yes, has got a very big decay and close to the nerve. That most likely, with the symptoms you were telling me, has got irreversible pulpitis. It means that even we remove the cause of the pain, which is normally the food, pain still stays there and linger. And that's why dear Sophia had a sleepless night last night. Does that answer your
ah,
question?
okay, doctor, that is great then. Doctor, what are you going to do for Sophia today?
Very good question. That's exactly what I was going through. So simply today, we try to for the right hand side that food catch is happening. Very simple. We just put a temporary feeling there to stop food catch. But for the left hand side, we need to try our best. I will try my best with a couple of behavior management techniques as a short term plan to first numb the tooth and then remove the decay happening. And most likely, I need to do a bit of a baby root canal treatment,
Doctor,
which,
sorry for
yes,
this, doctor. She's not really cooperating. What should we
I
do
know.
then?
I know exactly. That's why I mentioned behavior management. And we have a couple of techniques to try to make kids like Sophia comfortable in the chair. First of all, I should let you know that I work with lots of kids and I know what I'm doing and confident about it. Also, my nurse is highly trained and she's very friendly with kids. Then I will use a technique, tell Shadu that I will tell her what I'm going to do. I will show my instruments with simple words to her and get permission from her to start my procedure. We will put some shows on the TV. We have some toys here that she can hold on to them. You can be in the room. This is called distraction. Even if these simple procedures didn't work, I'm trained to use nitroxide to get her comfortable again. That's a very
Doctor,
slight
Doctor,
sedate.
can we ask her, like Sophia, what Sophia can make you happy? I think she's saying nothing of this can make her happy, doctor. What do you think?
Well, in that case, I will use nitrous oxide. I think that's
What
the
is this, Dr. Nasuksai?
well, nitrous oxide. We call it happy gas. Have you heard about it before?
No, look, you're just a general dentist. Are you allowed to do this Nasuksai? It seems like
It's
it's a complicated procedure.
No, it's not a complicated procedure. I've done the course for it and I have the facility here to use it as well. It's a mask that we put on her nose. It's a mixture of a happy gas and oxygen. It's very light sedation that will just make her happy, and she will let us do our procedure. And as soon as we are done, we just give a straight oxygen that will remove all the
Doctor,
effects of that.
that's okay then, Doctor. Doctor, can you please just in 30 seconds summarize what are the treatment you're going to do for all the affected teeth?
Yes, of course. So for the we start from the X-ray on the top. We will do a um, um, small temporary feeling for the area that has got a food catch, and for the left-hand side of her mouth, I will numb her up and do a pulp treatment, pulpotomy we call it, to get her out of pain and feel that area with a temporary feeling. And tooth in front of it, we need to remove it, and we will place a space maintainer for it until the adulthood comes out. And also, I will give you a referral. I suggest you to see periodontist
Thank
to
you very much.
do.
Time's up. Time's up. Time's up. Thank you very much. How you
Thank
feel?
you,
How the
doctor.
case, right?
I talked a lot. I don't like when I talk a lot. It means that I'm not ready. I cannot
Uh,
use short sentences. Yeah,
I made
that's
one
what.
of the thing here right now about this. I actually, yes, I bought my notes in regard this part. But you did very good, by the way.
Thank you, doctor.
I really can see this. You really did very good. Okay. So what do you think? Like, because you said right now you talk a lot. So if you were in a situation that you shouldn't speak a lot, so what could be the second version of the other version?
Well, if I'm well prepared, I have a smaller sentences in my mind that if you, for example, ask me what is irreversible pulpitis, I should come tell you in one sentence what is irreversible
Very good. You
pulpitis
see?
instead of explaining a lot, a lot,
Look
a
at
lot.
this. Yeah, that's exactly what I'm saying. You meant you talk, like you see in here what's the difference? When I asked you about one question, what is reverse pulpitis? Right? You gave me 60-second explanation. You don't need. But when I asked you about a reverse pulpitis, you cover this in only 10 seconds. I was very happy it was the second time. And this is one of the things that can make people pass actually in OSCE. As you mentioned, the concept is correct. Short sentences makes you pass the exam. Long sentences will not make you pass the exam. I totally agree in this. Now, let's think about this clinically. It's good, really. You start being really very good from the beginning. I like the way that you took the lead from the beginning and then you asked me questions to express about my feelings as a dad and how I feel. And then I was somehow emotional toward my daughter. And then you covered this point nicely when you said you look after her and then you feel sorry as well. Now, the things really can make you easily pass this case that you didn't refer this patient to specialist, which I don't like it. Because that shouldn't be the first option for you. And just in case, if you do this, because I know maybe some people went to the exam and they keep saying, like, I got similar concepts, I got similar things, and then I found actually, and then I said refer to special, and I passed. That can be passed if you really cover how you manage her today because she's in pain. Think about it clinically. If she's in pain, the best way is to manage her. And then what you mentioned about behavior management, including tell, show, and do, that was perfect. Plus, talking about nitrous oxide too was very good. And by the way, I may suggest something. Tell, show, and do. That could be something to really do it nicely by yourself. But any other things, I believe it much better to ask the dad. Ask the dad. Ask the dad. Say, what do you think can help her on dental chair? Have you been in this circumstance before, in experience in the past? Do you think just always try to engage the parents in the role play? You can easily ask the dad, right? You can ask him, what do you think makes Sophia happy? Do you think if I play some movies or cartoon on my screen here right now, that's gonna make her happy? And what so? Like, can you give me the name of this show, right? So, or maybe give her a toy. What do you think? So, always I like to engage the patient, the parents in this. Engagement is very important. What do you think about this, Dr. Parsia?
That's awesome. I'm writing it down. Yeah, I like that. Yeah.
Yes, always try to be engaged in your group play with the patient in the practice. That's exactly what makes good dentists in Australia can make money and then they can trust you. Like once you pass the exam, definitely you will, right? And then to be a really successful dentist, that's one of the things. They really will like you and they will come back to you for this behavior. I've been very happy with you because I know that people they actually get scared to talk about nitrous oxide. Say sorry, I don't know anything about nitrous oxide, doctor. I don't know how can I mention about it. I will not mention. Definitely, is their own choice, but I don't recommend it. Nitric oxide is for general dentist. As you said, it's only 1 day course in Australia. As if you do for extraction, sometimes you do 1 day course, right? It's just 1 day course, already very hard. It's easy to use. Things will be fine. But you have saved this man has saved his daughter. She she's in pain. She's in severe pain. She couldn't sleep for the last 2 nights. So in this case, if you're not going to manage her and then to do some treatment using nitrous oxide, are you going to send her back again to who? Who's going to help? If you are a dentist, you cannot help her. Who's going to help her then? A hairdresser? I don't think so. Painkiller? I don't think will work for this baby. Okay. What are you going to give her? Oxycodone on this, on an 8-year-old? That's going to be, I would say it would be okay, but that would be very bad. So the best way is to be confident, is try to offer help, and then believe in yourself and do not succeed and fix her, and that's it. Now, there is a big trick here, actually, I need to talk about. X ray, bite-wing X ray, it's not really confirmatory X ray. If I, for example, if you ask me about the management in of these teeth, I will not be able. By the way, let's cover this point first because I want to remove all this stuff. 60 seconds. I ask you about what is reverse pulpitis. States inflammation. The tooth is inflamed. That's it. And it can be fixed. Easy. What is reverse pulpitis? Mean the tooth is inflamed. That's why it's sore and sensitive, and it can be fixed. That's it. You don't need to explain too much for 60 seconds. If you want to say the pulp, say the pulp, or say the nerve, but just very short. Now, you said you have good experience with kids. I like it, but I don't like about the nurse. Definitely, the nurse should have been trained for it. It's not something extra you're gonna do. It's not something wow. Do you get my point?
I do get your point. Yes.
Yeah. So the nurse and you, both of you, right, should be nicely trained. But if you talk about yourself, you have good experience, and you have been. If you say like, you know what, I really really love to work with kids. I have my babies. I love always. I know how to manage them. I take courses for it. So I'm very into babies or to treat babies. They will be feel happy. But what about the nurse? Yeah, really, like I don't know, but I feel like it's not that much. Okay.
Okay.
Okay. So you said here pulpotomy. Am I right in this teeth?
Yeah, for 7.5, yes.
Yes. Okay. And you said here temporary restorations.
As a short-term management.
Yeah, short-term management. Okay. Let me just remove all this stuff first. Now, think about it now clinically. However, what you said right now, it does really make sense based on this X-ray only. But look closely here. I will show you something very interesting. Look closely here and make comparison between this tooth And this is the OSCE exam about how to catch a small thing. Look, what do you think has happened here and happening here? And this.
For
Can
set.
you see? Sorry, I don't know why I cannot see the. Can you
No, I can see the marks.
You can see the
That's
mark. Okay, that's fine.
yeah.
What do you think? Do you think pulpotomy will work in the tooth?
No, I'm going to extract that tooth. I'm not
Very
going to
good. You
pulp.
see, this tooth must go, right?
Yes.
And I don't think that's a tooth making him to wake up, make her to
No.
wake up.
No, it's not.
I believe this is the one give her all this pain.
Yes.
Because that's most probably irreversible bust, but this one could be chronic abscess. Why it's chronic abscess? Because no swelling has mentioned in the scenario anywhere. Right? And then no tooth has been tender as well. Nothing in the scenario mentioned. Tooth is tender. In anything in the scenario mentioned, tooth is tender? No.
No.
Because if this tooth is tender or there is swelling, I may think it is acute abscess. And acute abscess can give the same pain, like reversible bite somehow. But I have nothing to take me toward acute abscess in the whole mouth. Did you get my point?
Yes.
So mostly this is chronic because this radiolucency happening down there. Most probably it's a case of chronic infection, like chronic abscess. Chronic abscess can be more into discomfort rather than pain. Clear now?
Yeah.
Okay. To decide on my right treatment, I may need to take periapical x-rays in this case. Why? Because by doing x-ray, I cannot, what if, I'm just thinking, what if, let's take this tooth right now. What if this tooth or that tooth, because I don't know which one of them is actually when they brush the teeth make them feel happy, right? What if there is a radiolucency around that tooth or any radiolucency around that tooth? Do you think we'll be able to just only restoration?
No. We need to see. Yeah, we
Yes.
need to see the root and bone around it.
So now we need to, in language, we can say this way, most likely. So based on the first X-ray I took right now, most likely the treatment that tooth said that and the treatment that, however, I may need to confirm this by taking another X-ray, right? Just in case
Yeah.
if there is any infection, because this X-ray doesn't show the whole size of the tooth. So I need to know what's happening around the bone or in the bone. And then once I confirm it, so either I do restoration here, or it can be a nerve treatment, but definitely what I will do in this tooth is extraction because I see there's infection around, and then that tooth, most probably the tooth is just giving it the pain for the last 2 nights, and most probably or most likely that needs for nerve treatment, the way I explained to you. And there is another decay here. I believe it just only needs for a little bit of filling, and that's it. Restoration.
Yep,
Did you
I
get it
agree.
right now?
Yes.
Yes. So, any question about this case at all? But by the way, you did very good. I'm very proud of you. I always, like I always happy with your role play.
Thank you, doctor. Thank you.
No,
Question about this case.
sorry.
No, you're right.
Mm.
So, as a short-term treatment, this is a class of 3, and we assumed we hope that most of the information is provided. What are the most important questions that I have to ask from the dad about the pain so I can get to the proper? I know that one of the investigations now we found out I need to take more 1 or 2 PAs.
Mm.
What else?
Nothing, I believe so. Not
Should I
the dad cannot help in anything here in this case at all.
should I double check about swelling in this case?
I don't think so because look, we have. Oh, sorry, because I believe as long as has it been mentioned, not really very important because swelling it will be clear to you because you did investigations, right?
Yes, yes.
So
Well, probably.
if there is any swelling, will be you are a dentist, you can see swelling, so it should be mentioned in the scenario. And then there will be the reason comes to you, not just the pain, will be pain and swelling. I don't think so. You may be, but I don't think it's necessary. We need to rely on X-rays we have.
Okay. And my next question is that as a long-term treatment plan, um, is it okay that I will refer to, or I will suggest to refer to a periodontist to do under general anesthesia, be more efficient, more treatment in one session? Or I don't have to mention that, as
I
my
don't
long
think so.
treatment
This
plan would be
I
looking after her and regular visits.
you can if you want. There's no issue in this, but you must control the pain today, which is coming from that tooth.
After covering that,
Maybe,
hopefully I have more
maybe, but
time
I
and I
like you
want
to
to.
take a responsibility in your own and just fix it.
Okay,
Yeah,
good.
look, if they ask, let them ask. Say, doctor, do
Okay,
you think like may need to see a specialist? Yeah, maybe if this is your choice, that will be okay. Just if you want to get the treatment faster, but even you can do it. Why not? So like extraction. Look, this two teeth will be fixed in one visit, and these two teeth may be fixed in extraction can be done, and there's two visits altogether. It could be three visits altogether.
okay,
Things can be done. It's not really that much. Kids sometimes come to the clinic for you for three visits only for scale and a little bit of fissure sealant. It's not really a big deal.
okay. I
Right?
get the idea.
Yeah, but if they ask, say yes, could be. But let the patient ask. Ask the patient, would you have any question or would like to ask? And then I know you may think about what if I don't ask about special, what if I don't talk about special? I don't think it's going to be an issue because you already managed the whole case.
Sure.
Not necessary, especially he's driving 300 kilometers. If he's in metropolitan area, I would say that could be an option, but not but of this not. Okay.
Okay.
Okay. Do you have any question, please? Or anyone guys has any question about this case?
Doctor, I wish you a speedy recovery and I will
Oh,
mute myself if it's okay with you.
n- I have heard sorry the first sentence. You wish me speed recovery, and thanks
Yes.
so much for this. And the second one,
Um, I will mute myself if it's okay with you.
no, that's okay. Then thanks very much for
Yeah,
this. I
yeah.
appreciate it. No problem. Thank you very much.
Thank you.
Okay, there's a question from Dr. Rana, guys. Please, guys, if you have questions, start asking right now. Thank you, guys. Okay, Dr. Liv, ask question. Please, guys, sorry, I'm trying to cover all your questions from the top, but if I don't see, guys, I'm starting from the first question I can see here. That's from Dr. Liv, ask question. We do RCT in 7.5. 7.5, yes. Yeah, most likely it will be RCT in 7.5, yes. Dr. Repeat, what is diagnosed for the lower molar tooth with the big caries? This is infection, which is tooth number 7.4. It's an infection because I see redulucency around the bone here, bone resorption. But this too seems like it's just a reversible pulpitis, but we need to take an epic X-ray to confirm these findings about that tooth. Who knows? Maybe there's a pre-apical redulucency down there. If the kid is not cooperative, we can offer treatment in general anesthesia. No, as general dentists, no. Maybe that can be done by specialists, but not by us. But not today as well. Dr. Hand, ask questions. Dr. Hand's asking question, is it okay to numb both sides to treat hair today? I don't recommend this. It's no. Look, if infiltration, that would be okay because sometimes you can do infiltration for kids, no problem. Net, like for example, you can do infiltration for the upper, definitely, with no issue in that in both sides. And then I may recommend to work only in one side today, maybe the left hand side. The one that really has lots of pain. And then just to put temporary restoration in these teeth, as Dr. Parthia mentioned, and then without anesthesia, just maybe cavette for now. Or maybe chewy gum. You know what? But not for us. Chewy gum for kids, not for us. Like for parents, but not for us. For us, just cavet for now. Yes, 7-4 is extraction. You're totally right. Should we do cold test here? Look, it is your choice if you want to do cold test, but definitely it is not reliable in 8-year-old child. So I don't think will be that much beneficial, but definitely it's your choice to do it, but won't be beneficial. Another question. Would the start on most Yes, you're right, doctor. That's what I need to start with. What is the treatment plan for 5-5? Let's get 5-5. 5-5? This is 5-5. I don't think there's anything to do with 5-5. Seems like it's okay for me. Could be that a little bit of, if this is caries, you need to check it clinically. So we might just only do restoration for 5-5 if it's caries. So RCT for 7-5 and extraction for 7-4. Yes. It's not RCT, we call it most likely will be pulpectomy. No pulpotomy. This is will be pulpectomy, no pulpotomy. Because seems like this case of irreversible bites, you cannot do pulpotomy, but you can do pulpectomy. So pulpotomy cannot be done for irreversible bites cases, but pulpectomy should be used in a reversible bites cases. And this tooth is extraction, first 7 extraction. So please guys write down this, okay? Pulpotomy cannot be done in irreversible pulpitis cases, but in irreversible pulpitis cases or necrosis, you should do pulpectomy. Dr. Amna, can we do all the treatment today if the child cooperative? That's gonna be too much for a child to do all the treatment today. To open his mouth all that time, that's gonna be too much. No. I would say only one. You can consider only one side, maybe. You can do treatment in one side. I can do the left hand side today. I start with doing, I give anesthetic in that tooth and then do restoration here, GIC, easy. And then start with the first visit of pulpectomy. And then at the end, do extraction. Done for today. Next time, you can do this teeth with restoration plus finish pulpectomy. That's it. 2 visits, I think that's what can be done. Dr. Mubashir. Dr. Bidu, extraction of 4-7 after PA. Yes. Even it's clear for me here, but if you want to confirm with PA anyway, that's I agree on this. Because we have to make sure there's permanent tooth there. Even if permanent tooth there, you cannot keep this tooth because there's infection there. Even let's say if the permanent successor is not there, you cannot keep this tooth. You cannot save it. Must be extracted. Even this furcation, you see how the caries and furcation? No, this is must be extracted. Must be. There is no way. If take additional X-rays, may need to take 2 periapical X-rays and then OPG. I would recommend the periapical X-rays in this case because you really need to get a proper investigation for every tooth individual. I may recommend periapical X-ray rather than OPG. OPG will not be that much clear as periapical X-ray. Periapical X-ray is the best X-ray. For this case, Dr. Anna again. Today's concern is pain, so for food getting stuck, we'll fill it with GIC and call them back for composite. You don't need for GIC today, but it's easy as well to do GIC. But if you want to do cavate for today, that's okay. Cavate can be interim only for 2 3 days, but no more than this. Right? Means like if he's going to see you in few days, you can do cavate, otherwise GIC. But pick to me always should be done for reversible bites. Yes, that's true. Should be done. Should be done for reversible bites is much better. Yes, extraction can be done as well. Dr. Musa, Doctor, if immature tooth and irreversible case, immature, okay, and irreversible case, then we should do pulpotomy or pulpectomy. Depends on the nerve condition. If the nerve is still alive, do, sorry, do pulpotomy. If the nerve is dead, do pulpectomy, which is what we call it as apexogenesis and apexification. Apexogenesis, you do pulpotomy when the nerve is alive, and apexification, we do pulpectomy when the nerve is dead. Could we say to the dead that after all treatment we should prescribe all original prophylaxis activities? Yes, if you have time. I agree on this. All prevention, yes. Yes, if you have time in this case. And even you may need even to prescribe painkiller for this case too. One of the things can be done in this case too, would be a good idea, is prescribe painkiller for this patient for today. Even after treatment, Panadol will work after treatment. Yes, Dr. Mubaraka, because bifurcation involvement, that's why the tooth need to go. Dr. Bido, how much should we know about laughing gas? The exact information in TG, just open TG. Open TG, there's some, like few pages there about laughing gas, about nitrous oxide. That's only what you need to know about it. No, I don't think really can go in details in it. And by the way, I knew people actually couldn't pass this case only because they referred the patient to a specialist without managing the patient properly, without even giving painkillers, without talking about laughing gas, and they failed. And most of the people they actually covered this case by nitrous oxide, they pass. Dr. Nilo, Dr. Bido, can we do pulpectomy or have to refer to specialists? No, pulpectomy can be done by general dentist. It doesn't need to be a specialist now. At least if you're not confident, because it depends on your confidence. If you're not confident to do it, at least do pulp extirpation today. Pulpotomy contraindicated to yes, that's true. For fistula, drainages, abscess, reversible parts, that's all right. All of this you're right about all this stuff. No, Dr. Gilad, you don't need to use acid etch and bonding for GIC. How to gain cooperation of the child to do other investigation? Yeah, that we mentioned about it. We have behavior management. One of them is you tell the patient, and then show them the stuff, and then you start to do. Or you can use pharmacological management like nitrous oxide. Today is first pulpectomy. Yes, I agree. And quick temporary fillings for other teeth. Yes, and extraction. Next time finish, yeah, but we need to do extraction as well today. Yes, you can do extraction today as well. The last thing is extraction for force for a 7-4. I don't think an 8-year-old you still need to give any specimen maintenance. We need to check what's happening around because I believe that raption of the permanent successor comes within 1 or 2 years, most probably. I don't think we need to get space maintainer for this tooth. Yes, a lot. Even adult, not just only. Do in Australia children bite the lower lip after LA on lower jaw? Yes, and even adults as well, not just kids. Yes, Dr. Mills, very right. Yeah, for sandwich technique you may use, yes, for on GIC, yes. Pulpotomy, no. Pulpotomy will not help, Dr. Jency. No, it should be pulpectomy, no pulpotomy. Even partial pulpotomy, we don't prefer in Australia. Partial pulpotomy, partial pulpectomy, we don't prefer in Australia. We prefer, because once you give them anesthetic and then you can access the tooth, so try to remove as much as you can from the pulp, the inflamed pulp inside or inflamed tissue inside. And this is actually make the patient feels no pain or actually reduce the pain. So painkiller will work fine. Pulpotomy, we used to use formacrysol pulpotomy in the past in when there is necrosis or actually when there is irreversible arthritis, but I don't think it works in this case anymore. Can space maintainers done by general dentist? Yes. If the premolar fully erupts, we don't need for space maintainer. I agree on this, and you're totally right because permanent molar is already erupted on that. Jesse, I love this information. Perfect. That's another sign as well. Okay, guys, I believe I'm done with this case. It's more than 1 hour. Guys, if you really want me to do more cases like this on every Tuesday, please, guys, let me know. Yes, Dr. Mubaraka, you're totally right. We don't use, I think that was about 10, 15 years ago. We don't actually use formicrysol. We got an approach that's formicrysol not used anymore, and we cannot find it in the market anymore. Leather mix 50-50%. So leather mix means like you put 50% leather mix and 50% calcium hydroxide in some cases, like Caries. Thank you very much, Dr. Mubaka. Thank you very much, Dr. Melsmad. Dr. No problem. It was the best. I'm very happy, guys. You get all this information, this knowledge. I'm very happy. Thank you, Dr. Gagandeep. Do more, and the more we need, doctor. Okay, Dr. Mubarak, I will do this, definitely. We use dentin conditioner. Yes, that's a polyacrylic acid. We use it for, that's for GIC. Yes, and then, but you was asking about sandwich technique. Should we HM bond GIC for composite or not? If you're gonna cover it with composite, the answer is yes. Thank you, Dr. Shashank, and thanks very much for wishing me speed recovery. I'm very happy, Dr. Natalie, that you found this wonderful color. Thanks very much for this. Thank you, Dr. Mustafa, very much. Thank you, Dr. Indra. Sir, coming Thursday lecture topic, yes. Most probably will be prosthodontics, the one you like it the most, Dr. Tanvir. Every time you ask for it, right? So yes, so next time then. Get well soon, doctor. Thank you, Dr. Mabasha, for you good wishes for me. And by the way, you are going to do role play next Tuesday. Okay, be ready then. I'm sure it will be perfect. Thank you very much, Dr. Lev. Thank you very much, Dr. Parsia. Thanks, doctor, for the opportunity. Please do more cases like this, And also when are we gonna have access to the new OSCE bytes? Yes. I'm working on it. I'm working on my classes. So all my classes, I'm going to give you guys a new OSCE bytes, right? So this is going to be happen, I would say, next week after my class. So once I finish the class, I will upload straight away my OSCE bytes, the cases which I discuss. Okay? Try Jush, Jushanda, Jushanda. Okay. I will search for it. Johar Shushanda. Jushanda. Yes, thank you, Dr. Kainat, for your wishes, and thanks for your advice. Thank you. Can we use leather mix and no leather mix it's intracanal medicaments, leather mix. No problem, Dr. Kelvenda, very much. No problem. Thank you very much. Thank you guys. No, leather max cannot be younger than 12. No, no, no leather max for 12-year-old, younger than 12. I already had this information, this poster, um, on the page, on Facebook page. So please, guys, you can check it there. Thank you very much, you guys. Have a great night, every one of you guys. Thank you very much. See you then on Thursday. See you tomorrow for part one class, private class. See you then on Thursday for public class, mostly for part one, and will be pros two. And then see you guys again next Tuesday for, and the mock exam will be most probably this week too. Thank you very much, you guys. Have a great night, every one of you. Thank you very much.